So hi everyone, good afternoon and thanks for joining us for this briefing on VicHealth's local government partnerships. I'd like to start by acknowledging the traditional custodians of the lands in which we're all meeting on today, and I pay my respect to Indigenous elders past, present and emerging. I'd like to extend that respect to any Aboriginal people joining us today and invite everyone to consider that the sovereignty of these lands has never been ceded. It was and always will be Aboriginal land. My name's Jackie. I'm a Senior Policy Officer here at VicHealth, and my role is to work on the local government partnership. So just get to our first slide. So a little bit of housekeeping before we get started. In the email invite to this event, you will have received a Slido link, and that link is there for you to ask questions. You'll also be able to see other people's questions, so we encourage you to vote for those questions that you'd also like to see answered. We've allowed some time at the end of this presentation to answer those, but we will commit to making sure that we review all questions submitted and provide an answer via email and in our frequently asked questions section that'll be posted on our website in the coming days. So this webinar is being recorded, and we will make sure that that gets out to attendees after the session. If we happen to encounter any major technical outages today, hopefully not, we'll let you know that the webinar has been ended, and we'll make a recording and send it out for you and still allow those questions and those answers to be done. Okay, so VicHealth, as you know, is Victoria's Health Promotion Foundation, and our role is really about promoting good health and preventing chronic disease. So one of the ways that we do this is working with a wide range of community partners, including local governments, to support, I guess, funding and evidence out into the community to develop community-led solutions for the health and wellbeing of Victorians. A little bit about the partnerships themselves. So in 2019, some of you might know that we undertook a consultation with local government planners about the support that they needed for the municipal public health and wellbeing planning cycle for 21-25. So the partnerships have really been developed off the information that was provided. Our focus is really to direct support to the local communities who want to use this planning cycle and focus on creating a great start for local children and young people. The partnerships will suit local governments who are ready to make big changes for children and young people's health outcomes and who are ready to work alongside their community to achieve those. There is room within the partnerships to move and develop over time, so not everything is set in stone, and we're not necessarily asking for a really detailed project plan up front. We anticipate that the first year of the partnership will really be focused on the planning and development cycle of the plan, and with the following years focused on undertaking the activities that you identify and the strategies that you identify in that year one. So there is some flex within this partnership, and we really intend it to be a two-way partnership. We'll be looking to partner with local governments who have strong alignment with our priority areas for this partnership. So we're looking at Victorian children and young people, covering off an age range of 0 to 25, and we're looking specifically to support Victorian local government areas where communities are experiencing increased disadvantage. Our 3 health priority areas for children and young people are healthy eating, physical activity and mental wellbeing. So through your planning and engagement process at the moment, you'll be identifying priorities for your local area. It doesn't mean that you need to focus on every single part of that age range and every single health priority that we've listed, but it's about looking for local governments who have a focus within this area and are really keen to drive some action in those topics. We're also aware that obviously your health plan will have other priorities involved in it, so we're just trying to guide people towards that this partnership will be focused on these priorities, but of course you're welcome to continue the broader work that you need to deliver for your community through your health plan. So what do these partnerships actually provide? They're a bit different from our traditional grant rounds. So you might be familiar with our current Reimagining Health grant rounds. These partnerships are more focused on the connections and the support that are established over the life of the partnership rather than one-way funding relationship. So as I said before, it's important to note that the exact details of the partnership will be discussed with the successful applicants, just to account for your local context. So you might, as I talk through what the details can include, might be wanting to make a few little tweaks, and we're interested in having that discussion with you, and we'd invite you to note some of your starting point and your starting context, really articulate that in your application. So the first component is about funding and capacity building. The direct funding component is for 3 years in the first instance to assist you to add or increase hours for a project staff member who will support linking the partnership through the planning and development of your municipal public health and wellbeing plan. So we understand that this will vary depending on the current staffing arrangements of the partners. Some of the sorts of things we're anticipating that this staff member might do might be that they might contribute to engaging those children and young people in the development of the health plan. They might be responsible for coordinating some of the stakeholder or community workshops that you'll deliver, or perhaps they'll be responsible for the implementation of some of the actions once the health plan has been developed. The funded staff would be supported and networked through training and communities of practice. So where you have existing staff that would also be working on activities that would contribute towards the goals of the partnership, we'd welcome their participation in those professional development opportunities as well. So the funded officer and other staff that you might have that are working in the children and young people's health and wellbeing area. So the collaboration with expert partners makes up quite a significant component of this partnership. Deakin University's Institute for Health Transformation are a core partner for this work. And their role will be about building the capacity and supporting community leaders to apply systems thinking approaches to the planning and implementation of municipal public health and wellbeing plans. So providing some training, some software, and supporting that systems mapping process to really understand what are the underlying drivers for health and wellbeing for children and young people in your community. We'd be really interested to hear in your applications about any existing community networks and their readiness to work with you in your application. So there's a question dedicated to that. Through the partnerships, we'd also be looking to assist you in brokering further funding or further agreements that align to helping you achieve those goals in your locally identified priorities. So again, this will be developed in partnership with you to make sure that the support is relevant to your context. The support from Deakin will also extend to support building a locally led child and health monitoring system. You'll get access to regular, detailed data about the health status of children and young people at a local level. And this has been identified as a gap by many local governments in our earlier consultation. As we'll be developing the partnerships in line with the development of your health plan, there's also an opportunity to strengthen the monitoring and evaluation frameworks you apply to your whole health plan. And the final component to talk through is the health promotion modules. So VicHealth, along with some of our expert partners, are in the process of developing health promotion modules, and these are specifically geared towards local governments to help them implement policy and practice change across a range of topics. So the focus will be on policies, programs, services, facilities and communications that have a greatest impact in local communities. The modules will actually be available to all Victorian local governments, whether they're eligible for this partnership or not. But the partnerships will provide the opportunity to be supported through the process of delivering those modules that you identify that best align with your local priorities. So some modules will also come with some additional implementation funding as identified over time. It sort of depends on the scope of the modules. We wouldn't really be expecting the modules to be implemented in the first year. This is something that will come up once your health plans are sort of set and endorsed. They align with topics across a wide range of areas in VicHealth's action agenda, but we are open to the idea that additional topics could be added and developed in collaboration with our local government partners if a gap's been identified. All right, so how will participating local governments contribute? We're really seeking to partner with local governments who are prepared to make commitment toward the goals of the program. So there are a few conditions on your participation. Partners will be required to include children and young people in the planning and delivery of the Municipal Public Health and Wellbeing Plan and place their healthy eating, physical activity and mental wellbeing at the heart of those plans. So we're really looking to see changes at the community level, and successful applicants will be required to state this commitment when agreements are signed. For this reason, it's really strongly recommended that you have the backing, that you have the confident backing of your council leaders before submitting your application. We'd also expect to see some alignment of in-kind contribution from the participants. The size of your and capacity of your council will be taken into account at assessment when you make the statement about this, but you'll be asked to highlight the contribution of management and leadership staff hours, of project officer hours or programmatic budget that you have already that you'd like to gear towards achieving the goals of this partnership. So just to make it crystal clear, we've used the Index of Relative Socioeconomic Disadvantage to develop our list of eligible councils. And as I said before, we're really geared towards driving this partnership in areas that have decreased access to some funding, fewer resources or a greater need to address children and young people's health and wellbeing. So only these councils will be eligible to apply. This list will make this list available through the guidelines as well. So a few key dates. In the next phase, we'd encourage you to go away, have a discussion with your leaders and colleagues, potentially any community partners that you already know that you'll be working with, and have a look at the information in detail, the guidelines that we've prepared, and have a discussion about whether you think this partnership is right for you and start gathering the required information. The applications will open next Wednesday, the 28th of October. Through which time we'll be available to take inquiries. We won't be able to review applications in detail, but we're certainly happy to have a discussion about the parameters of the partnerships or provide clarity on things like that, and also obviously support you with the Stakeholder Portal and the tech issues of actually processing your application. There'll then be a couple of weeks of an assessment period so that we can do our sort of checks and measures that we need to do at this end, and we'll be expecting to make notifications to successful and unsuccessful councils by the 18th of December this year. Following that, as I said before, we're sort of considering this in two key phases. So the first phase will be really focused on the planning process, the engagement and setting priorities with and for children and young people. And then following that, there'll be 2 years where we're focused more on the implementation of the identified strategies. We have a view to extending this through to 2025 where priorities continue to align. But for this initial set of partnership, we're looking at the first 3 years to get things up and running. But yeah, with that view to extending through to the end of the health plan. So, there are some recent changes to how partnerships make an application through to VicHealth. We've got some updated software. So if you've submitted recently as part of Reimagining Health grants, you might already be familiar with this, but in general, I'll just provide an overview of some of the things that you need to gather and provide at this step of your application. So there's a number of bits and pieces that are outside the accessible content. And these are detailed in your briefing notes, but they include sort of standard things like your organisation's detail. You'll need to set a day-to-day contact, so that might be somebody like yourself or a colleague, and then an authorised contact who needs to be the CEO of your organisation. And there's a few standard declarations that you'll have to make. Again, these are detailed in our guidelines. I just want to give a little overview of the accessible questions, just to help you sort of preparing your application. So there's sort of 6 key things that we'll ask you to respond that will be accessible. In general, just a really brief statement of your intention, overall what it is, what are you trying to achieve, just a really high level summary. We are interested to hear from you, I said, a sort of description of the health and wellbeing of children and young people in your area, using supporting data if you have it available, and some of the key issues that you see emerging from within this age group. Once again, it doesn't have to be the full 0 to 25 if you know that there's a specific sub-cohort that you're interested in working with, but use your data to tell a story about why. As I mentioned before, we're really interested in hearing in your starting point, what are some of the existing work that you've got going and how would that interact with the partnership? How can you really make the most of using this partnership to coordinate this work or add value to the work that you've already got going? We're really interested to hear a statement about how you'll go about including children and young people's voices in the planning process and what do you think the potential benefits of this would be? And a little bit of a summary of your expected in-kind contribution. So, sorry, I just couldn't see that one for a sec. So a little bit of an outline of that contribution that I said before about staff hours or programmatic resources that you'll expect to contribute. We'll be looking for a few different things when we're assessing it. It's not necessarily just about having a huge track record in this area. We are interested in people who are sort of, I guess, earlier in the piece of really including children and young people's voices through that health planning process. We know that people have undertaken different processes before in their health plans, but we're really looking for councils who are able to talk about the impact that they'll make, the local need that they had, and most importantly, the commitment they have to creating these changes. We're also really looking for applications that focus on the role of council and less interested in applications that talk really strongly about a need for sort of individual or education strategies. We're looking for you to think about, well, what are the policy and facilities that we have at council that we can really make these healthy environments available. So those are probably the main things that I think are really important to consider when you're preparing your application. As I said before, I'd really encourage you to go away and spend some time reading through the guidelines and just making sure that you're across what it is that you need to do. We're available from the get-go to answer your inquiries, but we'll be preparing some responses to your questions from today. As I said before, we've got a couple of new things at VicHealth, and one of them is our Stakeholder Portal. So if you haven't registered through the Reimagining Health grants, I'd also recommend just having some time early on once applications open to just get that established. We'll provide some pretty detailed how-to guides, but if you're having any trouble at all, just give us a call and we'll help work through. One hot tip from the Reimagining Health team is to not use Internet Explorer, to use the Stakeholder Portal. Not very Internet Explorer friendly, so try and give Chrome or Firefox or something else a go. The guidelines will also detail out some of the standard requirements for entering into an agreement with VicHealth. These are about how you execute your contract, how VicHealth needs to be acknowledged in the activities that you do, and some of the reporting requirements that we'll require through the agreement. So successful applicants will be able to enter into this agreement. There'll be some negotiating and we'll present those agreements to you to stepped out. So these ones are standard. And I guess that's something to be aware of in advance, that if you're a successful applicant, these are the things that you'll be required to deliver once we reach that stage. Okay, another new thing which we'll show in a moment, but not just yet, a video about the harmful industry relationship declaration. Again, if you applied through Reimagine grants, you might have already seen this video. But essentially, we need to be making sure that we are improving the health and wellbeing of Victorian families and communities through everything that we do, and that we're not undermined by any harmful industry activities. So I'm going to throw to Duncan, and he's going to put up a video that will talk through, I guess, the background and the details of this declaration.
Hello, everyone. So when we talk about harmful industry relationships, we're referring to those companies or organisations that profit from the sale of products that can be harmful. So that includes tobacco, alcohol, gambling products, and unhealthy food. Now, if Maya mentioned earlier that any organisation that has current relationships or past 5-year relationships with the tobacco industry are not eligible to apply. In regard to the other harmful industries, we have a policy that we're applying now, and this will be relevant for grants that will be of a value over $35,000. So if you are seeking to apply for a grant for that amount, you will be asked in your application to make a declaration. And that declaration will require you to declare any current, planned, or past 12-month relationships with the food, sugary drink, alcohol, or gambling industries. Now, I really want to emphasise again that this, unlike with tobacco industry relationships, making a declaration about these other industries will not affect your eligibility. You are still eligible to apply, but we do ask that you make a declaration about these types of relationships you have. And VicHealth will then make an assessment against the risk, in terms of the risk that that harmful industry relationship might have to what we're trying to achieve through community health and improving health and wellbeing. Also to emphasise that these harmful industry declarations will be considered alongside the other criteria relevant to the application. So some of the many other things that Maya mentioned earlier and that are in the grant guidelines. This declaration is one of many considerations. It is not a black and white or an eligibility threshold decision. It's just something we need to be aware of, assess the risk, and then that's one of the many considerations that is taken into account in decision making. Next slide, please. So in terms of what relationships are needed to be declared, basically any current or past 12-month relationships with those industries. You'll notice that we do ask for all food industry relationships, and that's just because defining or trying to work out what might be unhealthy food versus healthy food can be challenging. So we do ask that all food relationships are declared, and obviously if you have a relationship with a healthy food provider, then that will be taken into account. In terms of the relationship type, it's really any relationship. So it could be a sponsorship deal, it could be a contract you have, a formal or informal partnership, or whether you've received donations, it could be distributing free products or branded merchandise. All those sorts of relationships need to be declared. In addition, if you are governed by a national body or you have a number of different business units within the organisation, you do need to include any relationships they have, anything that's relevant to your organisation, even if it's a parent company or a national affiliated organisation. Also, individual relationships. So if there are particular staff that will be involved in delivering the program, if you're successful, we ask that any relationships that staff member has with those industries be declared as well. And industry refers to producers, manufacturers or retailers of harmful industry products, as well as organisations that are funded by industry, such as foundations or lobby groups. In terms of what you don't need to declare, you don't need to declare if you have retail arrangements. For example, if you sell harmful products at canteens or venues, or if you have venues that supply gaming machines and it's purely a retail relationship, then that does not need to be declared. You don't need to seek declarations of any subcontractors that you may engage to deliver the project. And there's a few others listed there, such as nutritional brands and vitamin companies and things like that. I think our message is really, though, if you're in doubt, if you're not sure, declare, and then we will take all the context of your declaration into account. There is more information about this policy and how it's applied on our website, and I think those links will be provided in coming slides. Thank you.
Okay, so we will make also that video will be part of the recording, and there's quite a detailed page on VicHealth's website that sort of talks through the different requirements of that new policy. It is worth articulating that in the contracting for this project, for these partnerships, we will also be making an additional requirement that relates but is not covered by the full policy, in that we expect councils undertaking activities through this partnership to really make a concerted active effort to minimise any potential risk of exposure to the children and young people participating in the activities through the partnership from harmful industries, marketing or promotion. So by that, we sort of mean consider the venue that you're holding things in. Are they at risk of being exposed to alcohol marketing or gambling marketing? Some of those sorts of things. So are you working with a sporting partner that has unhealthy logos on their jerseys? We're just asking that through this partnership that councils really make a concerted effort to reduce the risk that young children and young people have the potential to be exposed to any of those harmful industries. So I've got a few questions that have been sent through, and they're great questions. A couple of them are a bit curly ones, but I'm going to read them out and I'll do my best to answer them. If we can't answer them today, we'll be preparing a written answer and we'll make sure that that goes available to everyone. So I might just click to my next slide. So just so you know that the follow-up information is on the screen now, but I'll have a look at these questions. So one of them is, if we have a different project idea that could support children and young people's wellbeing in our municipality, could we submit this for this partnership? And I'm going to say the answer to this one is no. So if it really goes outside the link, the goal of the program to achieve that change through the Municipal Public Health and Wellbeing Plan, we wouldn't consider it. Or if it diverts really extensively from those project components, then no. If you think that there's strong alignment and you're not sure how strong that alignment is, that's something that perhaps we can discuss over the coming weeks. But essentially it needs to be able to meet the goals of that program, those parameters. I will say that there is still another few days left to apply for VicHealth's Reimagining Health grants, in which you could potentially provide different project ideas. So there's quite a wide range of opportunities, with children and young people also being one of the priority areas for that grant round. Given the target cohorts, has the Department of Education and Training been engaged? We're working closely with the Department of Health and Human Services on this one. As yet, we haven't engaged the Department of Education and Training. I think that's a really interesting idea. It's certainly something that we could consider. I think they'll be open to that. There's certainly a link through some of our contacts, but to this date, no, they haven't been engaged. How many councils will be funded? We have the opportunity to fund up to 10 councils through this partnership. Can multiple council areas work together? I think this is a great question. I think the answer is probably yes, but it might depend on the number of councils you're talking about. So keeping in mind that we can't fund more than 10, I think we would still definitely consider those applications, but we might need to think carefully about the specific details of how we ask you to do that. Are we asking you to submit separate applications? Is it considered one application, and how would the funding arrangement work? I think that's something that we need to consider. So I think we'll get back together as a team and prepare a written response for that one so that we can be clear. Someone has asked, our council has administrators in place and will not have council elections until next year or endorsed plan until 2022. Are we still eligible? I would say yes, you are eligible. so long as you think that you can meet that condition, that when your plan is endorsed, it will centralise the voices of children and young people. So in this instance, and it relates to the next question as well, that gaining the support from your council leaders at this phase can be talking about your on-staff leaders, I guess, for this process. Yeah, I think hopefully that answers that one, but if not, let me know. And the next one says, need to note that the councillor endorsement and support might be difficult at the moment as the council election might not be declared until mid-November. So we understand this requirement. It's a bit of a challenging one for timing, because we do want to support you and make sure that the funds are getting out to you early enough to be useful in the development of your municipal public health and wellbeing plan. But we're aware, obviously, that the limitations that council elections place. So I think yes, you will be, as long as you think that you can meet those requirements that are stated in the guidelines, then I think you will be eligible, but consider that your council leaders can include your on-staff leaders, your CEO, management, and that leadership support can be gained that way. But again, happy to have further discussions afterwards. And the last question is, where do we find the guidelines, please? So at the moment, we've got a bit of a skeleton website up. And once we've sort of finalised this video, once it's rounded out, that will be the recording, and the relevant information will be all posted online. So if it's not up this afternoon, we'll expect it in the next day or two, and you'll receive an email with giving you an update that that's been made available. So I think that is most of the questions. So just to come back to that final slide to say, you will receive some of this information afterwards. There is a bit of detail to read through, but we're certainly happy to take your questions over the coming week and throughout the application period. I'd encourage you to start gathering your information as early as possible, so that it doesn't get to that stressful point towards the end when submissions are due. We've got a partnerships email up there, and we also have, we've got an extra question. Are supermarkets included as a harmful industry? Sorry, I'll answer that one quickly. So if you have a relationship in the way that Emma has described, in that they are a sponsor of your event, then yes, all relationships with any food industry should be declared. It doesn't mean that you won't be considered. It doesn't mean that your application will be disadvantaged. It means that VicHealth is interested in making an assessment of the final, I guess, of the potential risk for exposure of children and young people to those harmful industries. So the best thing is to just declare it, and then we can figure out what that means and how we might work with you to limit children and young people's exposure. Ooh, I'm getting a few more additional questions, sorry. Assuming this will constitute only part of the municipal public health and wellbeing plan, and other priorities and cohorts can be covered in other sections of the plan. So yes, the partnership and the efforts of the partnership will contribute towards the priorities that relate specifically to children and young people's healthy eating, physical activity and mental wellbeing as a core part of your plan, but it does not limit you in any other way from continuing your work to address the other priorities that you might have. So something like preventing violence against women, absolutely include it if that's a local need for you to address. We're just saying that the resources and the efforts dedicated through this partnership should be primarily focused on those children and young people's health and wellbeing needs. So I think, sorry, that was my final question that came through in the chat. If there are things that you'd like to follow up with afterwards, as I said, that email is available. You're also welcome to call us on VicHealth's standard, our central reception line, and those phone calls will be forwarded through. So we're not in the office, but we're certainly working together on the phone lines. And yeah, I thank you very much for offering us your time this afternoon. I look forward to chatting with you all soon.